The reason that I think that Children's Hospital Los Angeles is really the best place to train to be a pediatric critical care attending physician is the depth and breadth of experience we get here in a very large city as a large referral center that takes care of a myriad of very complex disease processes.
CHLA does really have the benefit of having an incredibly diverse set of patients.
Some of the surgeries that we perform in our cardiac ICU, people from all over the world come here for those cardiac surgeries, and a lot of other fellows in the LA area rotate through our cardiac ICU to get more experience with ECMO and heart transplants. We have 5 fellows per year. We split our time between the PICU and then the cardiac ICU, as well as we get to do some time in the OR with anesthesia, and you do some sedation your first year as well as a fellow here.
Being a fellow here at Children's Hospital Los Angeles, I am literally working among the giants in our field, and it's humbling and it's so exciting to be rounding with huge names in the field of pediatric critical care and learning beside them.
It was a little intimidating at first, and then one of them, who is one of the most probably famous respiratory researchers that we have in the country, he refuses to let you call him doctor. And wants to go by first name, and it just shows the collegiality amongst our group here and how informal we are, but how much we respect each other has just been a really cool experience.
Our training is very robust and can be grueling and exhausting, but also exhilarating, and everyone really supports us and has the fellows learning at the forefront. But not only that, our wellness is a priority for everyone involved in our training.
The amount of autonomy in general that we get here has been amazing, and it's something that I didn't see when I was interviewing at other programs.
That absolutely comes from the trust that the attendings have in us to run rounds and to make decisions and to be the face of the team. And that kind of preparation, it can't be simulated in any other way.
One of the strengths of the critical care program at Children's Hospital Los Angeles is really the breadth and depth of research opportunities available.
Our attendings are helpful and are willing to do and work with you in whatever you want to do, whatever your interest is. They will find someone, even if it's not in our department, that will work with you to create a fellowship research project that you're interested in.
We have a formal leadership curriculum, which is monthly for the first year and then goes throughout our 3 years of fellowship.
When we are emotionally intelligent, when we communicate well, patients stay safe, patients die less. So we embarked on a curriculum that was about personal mastery and leadership development. It's a unique program. I really don't know anywhere else in the country that does this, but that's how important we feel it is to grow our trainees and to have that translate into how kids do.
I really, really think that of all of my training experiences in med school and residency and palliative care fellowship, I feel the most different on the other side of this one because of the very specific type of education and leadership that we have the opportunity to participate in here.